All right, guys. Eric Christensen from Chandler Physical Therapy here. Wanted to touch base on something that I see in the clinic almost every single day. You might have heard it as lower cross syndrome or as lower cross posture. It's something that is pervasive in many dysfunctional movement patterns that I see coming into the clinic, and wanted to touch base and educate you guys a little bit on what it's all about and maybe some of the things that you can be doing to prevent it. So lower cross posture it's a combination of two things. It's a combination of weak or as I like to say, maybe inhibited abdominals and weak glutes, particularly gluteus maximus, but your hip abductors, your gluteus minimus, and your gluteus medius as well, combined with tight or overactive low back muscles or your thoracolumbar extensors and your tight hip flexors. And so when we look at it that way, if we get here, we get one cross, and come in here, we get the other cross, thus the term lower crossed posture. And what really happens is that this is very common when we sit, because when we sit, the hip flexors are shortened. So if we're sitting here, the hip flexors here have a chance to get shortened so that when we stand up, they're tighter than they used to be. Combine that with the fact that when we sit, there's direct pressure on our hiney, and direct pressure is inhibitory to a muscle, or that it turns it off or slows it down. And that's good. It's how massage works and how soft tissue therapy works to make a muscle less tight. But when you need to use that muscle, it's not necessarily a good thing. So say you're sitting for 6 to 8 hours a day, you go to stand up. Now we have really, really tight hip flexors and then really weak glutes. And then we carry that into our workout without correcting it. That's where we see a lot of problems come up. So the problems that we see with this can be far ranging. And because really when we take away the natural stability of the midsection of the core, so to speak, things above it and below it are going to be affected. And it can most often present, I would say, as low back pain, whether that's sciatica, whether that's just general lumbago, that you have pain in your back, particularly specific movements. It could be genesis of hip pain or neck pain, because, again, if you're sitting poorly or the base is not there, the head's going to hang out in a different spot, which can cause pain there. It could cause knee pain because if the hips or the low back aren't absorbing shock well, something else is. The knees are usually one of it. And there can also be ankle pain because if everything else isn't controlling it, things are going to stiffen up in response to that. Ankles are very common to get stiff and limited with that. So how do we fix this? And that's a long-ranging question, because there's nothing that is going to be immediate with lower cross posture. It's an awareness and it's a management tool. So in a very short, abbreviated section, we got to get the abdominals, your obliques, and your glutes working more regularly and less inhibited. And that's regular, especially if you sit all the time, because you're constantly working against that natural progression. And then you also got to work on getting your hip flexors, your quads, your lower back looser so they're not as active. And there's lots of different ways to go about that. Physical therapy is a great way to do it. We are one of the best ways to address movement dysfunction and really teach you how to self-manage. You're not going to get that anywhere. And I think once you have the tools, it's really just finding the time and the dedication and the consistency to doing it, checking a couple boxes every single day just to make sure things are moving smoothly. As always, if you guys do have questions, please feel free to contact us. Phone numbers there, 480-786-4969, and our website is chandlerpt.net. And I know a lot of people out there aren't really sure what physical therapy is about, and I'm very well aware of that. So if you think you have something going on and you want to chat with somebody before you commit to that full treatment of physical therapy, I highly encourage you to do so. We've got a website at chandlerpt.net/free screen. If you go there, it'll give you an option to sign up and put your information in, and then we'll reach out within 24 hours to contact you to answer those questions to see if physical therapy is a good fit for you. As always, if you guys do have questions, please don't hesitate to contact me directly.